Are you concerned about how breastfeeding can impact your fertility? In this video, I'm going to discuss the effects of breastfeeding on fertility and provide tips for maintaining healthy reproductive health while nursing. 1. How does breastfeeding affect fertility? Breastfeeding can cause a decrease in fertility because it causes a woman's body to produce hormones that inhibit ovulation, which reduces the chances of conceiving. When breastfeeding is exclusive and not supplemented with formula or other foods for at least 6 months, this effect on fertility is most pronounced. As a result, women who are exclusively breastfeeding typically have lower levels of estrogen and fewer signs of ovulation than when they were not breastfeeding. Additionally, exclusive breastfeeding can lead to amenorrhea, absence of menstrual periods. 2. What are some tips to help maintain fertility while breastfeeding? The hormone prolactin that is released when you are breastfeeding can have a direct impact on fertility. However, there are steps a lactating mother can take to maintain her fertility while still providing the best nutrition for her baby. First and foremost, mothers should talk with their healthcare providers about any concerns they have surrounding breastfeeding and fertility. Healthcare professionals will be able to provide individualized advice tailored to your specific situation. Secondly, mothers may want to consider employing certain strategies that could help minimize the effects of prolactin on their fertility while still allowing them to meet the nutritional needs of their baby. Breastfeed your baby as often as possible, but aim for shorter durations during each session. This will help to reduce the amount of prolactin that is released. Choose times when your baby feeds less frequently, such as at night, and supplement with formula if needed. This can also reduce the amount of prolactin in the body. Consider pumping breast milk for longer periods between feedings so that you can provide bottle feedings instead of breastfeeding directly. Take a break from breastfeeding every once in a while to give your body a chance to readjust hormones back to normal levels, which will help with fertility. 3. Does breastfeeding reduce the production of reproductive hormones? Yes, breastfeeding can reduce the production of reproductive hormones. The hormone prolactin helps to initiate and maintain milk production in women who are breastfeeding. Prolactin suppresses ovulation, meaning that it inhibits the release of an egg from the ovary. This means that while a woman is breastfeeding and her prolactin levels remain high, she will not be able to get pregnant because she won't be releasing eggs for fertilization. Additionally, elevated levels of prolactin can reduce estrogen levels, which play a role in fertility and menstruation. During this time, menstrual cycles may become irregular or stop completely until a woman stops breastfeeding or significantly reduces how often she is nursing. 4. Can breastfeeding cause ovulation to stop? Sometimes breastfeeding can cause ovulation to stop. It is known as lactational amenorrhea and occurs when a woman is exclusively breastfeeding her baby around the clock and has not had any menstrual cycles since giving birth. This occurs because the hormone prolactin, which helps produce milk in lactating women, may suppress other hormones necessary for ovulation. Lactational amenorrhea can last up to 6 months after childbirth, although it is more likely to cease once the baby's feedings become less frequent or if another form of contraception is not used. Women who are breastfeeding should talk with their healthcare provider about how breastfeeding might affect their fertility and what forms of contraception might be appropriate for them. 5. Can breastfeeding interfere with the menstrual cycle? Yes, breastfeeding can interfere with the menstrual cycle. After giving birth, a woman may not get her period for some time due to the hormone prolactin being released during breastfeeding. This is known as lactational amenorrhea and usually occurs in women who exclusively breastfeed their babies. The duration of lactational amenorrhea varies from woman to woman, but can last anywhere from 6 months to 2 years or longer. Additionally, studies have shown that prolonged periods of lactation longer than 12 months can lead to absent or infrequent ovulation, which can delay fertility until regular ovulation resumes. It's important for women to be aware of this potential side effect so they know when it's safe to start trying for another child without risking an unplanned pregnancy. 6. How long does it typically take for fertility to return after you stop breastfeeding? The amount of time it will take for fertility to return after stopping breastfeeding can vary from woman to woman. Generally, fertility starts to return within 2 to 6 months after you stop nursing, and regular menstrual cycles usually resume within 4 to 9 months later. It is important to note that if you are exclusively breastfeeding, meaning without other sources of nutrition, or supplementing with formula less than 6 times per day, your body may still be suppressing your ovulation even though you have stopped breastfeeding. Additionally, some women may not see a change in their fertility until they wean completely. In any case, it is best to consult a healthcare provider before making a decision about when to start trying again if you are planning on having more children. 7. Are there any supplements or vitamins that can help improve fertility while breastfeeding? Yes, there are supplements and vitamins that can help improve fertility while breastfeeding. These include folic acid and omega-3 fatty acids, which both play a role in increasing egg quality and implantation. Vitamin D is also important, as it helps the body absorb calcium for strong bones. Additionally, probiotics have been found to support healthy vaginal flora, which can help increase your chances of conception. Finally, taking antioxidant supplements such as CoQ10 or vitamin E may also be beneficial for improving fertility while breastfeeding. By incorporating these vitamins into your diet and lifestyle, you can support healthy breast milk production and menstrual cycle regularity without compromising fertility. We hope this video has provided you with some helpful information on how breastfeeding can impact your fertility. If you're currently breastfeeding, we recommend incorporating certain vitamins and supplements into your diet to help support healthy breast milk production and menstrual cycle regularity without compromising fertility. We'd love to hear from you in the comments section below. Let us know if there are any other tips or tricks that have worked for you. Don't forget to like and subscribe so that you don't miss out on more informative videos like this one.